Beyond the Bed, Pressure Injury Prevention, Hospital and Home. What a great title, a great topic, and one that many are so interested in. And I know the journey of Jennifer and Sarah has been an amazing journey through their time as a BPSO organization. And I have been privileged to actually be their BPSO coach, and I have learned so much from them. Let me begin with introductions. Jennifer Edwards is the Director of Quality Clinical Practice and Risk across Norfolk General Hospital and West Haldeman General Hospital. With over 5 years in this dual site executive role, Jennifer provides strategic leadership across patient safety, clinical best practices, policy development, patient experience, and person-centered care. A very dedicated champion for healthcare quality. Jennifer leads corporate engagement strategies that improve patient safety outcomes and drives the development of quality improvement plans. Jennifer shares her experience on local, provincial, and national stages through the RNAO BPSO program and other healthcare associations, focusing the successful implementation of best practice guidelines and tailoring clinical quality initiatives to meet the unique opportunities and needs of the rural community that Jennifer serves. And we also privileged to have Sarah O'Haron here with us as a registered nurse and clinical nurse educator and best practice spotlight organization lead at Norfolk General Hospital and West Haldeman General Hospital. With a clinical background in long-term care, medicine, and critical care, Sarah is passionate about translating evidence into everyday practice and creating meaningful, sustainable change. She leads the implementation of RNAO best practice guidelines, champions engagement, and develops education strategies that empower staff to deliver high-quality, person-centered care. Sarah has successfully led initiatives that have significantly increased best practice champions participation and engagement across 2 acute care hospitals while fostering a culture of collaboration, professional development, and continuous quality improvement. Sarah's work has highlighted practical approaches for implementation of evidence-based practice in real-world healthcare settings. Sarah is committed to inspiring healthcare professionals to embrace change, challenges, and challenging the status quo and improve outcomes for both patients and care teams. Well, as I mentioned at the beginning, it's my absolute privilege to have Jennifer and Sarah here. And I know, just like myself, who has learned so much from them, that today is going to be a day of sharing knowledge and really learning more about the journey of West Haldeman General Hospital and Norfolk General Hospital, and with the leadership of Jennifer and Sarah. So I will hand it over to you both, and thank you again for being here.
Thank you very much for that warm introduction, Julianne, and thank you everyone for attending today. We really appreciate you taking the time out of your lunch hour to hear about how our planning implementation outcomes of our open house went, and that's what we'll be going over the next 25 minutes or so. So starting here, just thinking about in healthcare, delivering exceptional patient care really requires that evidence-based practice, strong collaboration, and dedicated clinical leadership. To support these goals, an immersive, interprofessional open house featured a formal best practice guideline champion pinning ceremony. The event brought together frontline staff, allied health professionals, community partners, hospital executives, board members, specialized vendors, and our local mayor and a provincial government representative. This event was designed as both an educational hub and a celebration of professional achievement, and event championed patient wellness while honoring our practitioners leading the practices in our organization. Sorry, there we go. So just to go over our organizations a little bit and get a sense of what we work through. So West Haldeman General Hospital is a leading rural community hospital and employer in the Haldeman County. With 23 acute care beds, we provide comprehensive patient-centered services, including a 24-hour, 7-day-a-week emergency department, acute inpatient care, day surgery, diagnostic imaging, which includes X-ray, ultrasound, mammography, and echocardiography, laboratory, physiotherapy, and a range of outpatient specialty clinics, such as diabetes and audiology care. West Halton serves over 25,000 community members, including Indigenous populations. We continually collaborate with partners to enhance care efficiency and quality. In 2026, we were proud to be named one of the Southwestern Ontario's top employers, recognized for our strong culture of employee well-being, flexible work options, staff recognition events, and generous mental health and retention benefits. Norfolk General Hospital is the leading healthcare provider and major employer in Norfolk County, serving communities including Simcoe, Waterford, Port Dover, Delhi, Port Rowan, Long Point, and surrounding areas. We range from 107 to 120 bed of a community hospital, and Norfolk delivers comprehensive care through a 24/7 emergency department, obstetrics department, medicine, internal medicine, anesthesia, surgical, critical care, complex continuum care, and a various specialty outcome clinics. Equipped with advanced diagnostics like a 64-slice CT scanner, digital mammography, minimally invasive surgical suites, and a 6-bed ICU, our focus is always on enhancing patient and family experience. Both sites are accredited with commendation, standing, recognizing the high quality of safety of the care we provide. Our BPSO journey. It began in 2024 when Norfolk General and West Halton General became a pre-designate BPSO with the RNAO. Our original implementation plan focused on 3 best practice guidelines: transitions in care and services, people-centered care, and delirium, dementia, and depression. We began with transitions in care and services, concentrating on improving outcomes for our most vulnerable patients. Our steering committee developed a complex patient definition to target a manageable patient population while allowing for flexibility to shift the definition over time. Our patients meeting the criteria of 65 years or older, a clinical frailty score of 5 or greater, a Braden score of 14 or less, and no identified primary care provider became our initial focus. Using this definition, the team implemented readiness assessments and post-discharge follow-up phone calls, strengthening transitions from hospital to home while supporting safer, more coordinated care. Recognizing that sustainable change depends on engaged staff, we simultaneously began focusing on a strong network of best practice champions. Through a variety of recruitment strategies, including our highly successful Tournament of Champions, thanks to Sarah, staff became active partners in implementing evidence-based practice and providing valuable feedback throughout the change process. Today, just over 53% of our staff are best practice champions. As we prepare to begin our second year in implementation of our next BPG, we deliberately revisited our organizational priorities. Through our strategic plan redevelopment process, we conducted an environmental scan. We also included internal information such as wound care referrals, clinical scholar tracking, staff interest surveys, and our annual education survey. It became apparent that an emerging organizational need had us change focus. Rather than proceeding with our original implementation, we adapted our plan and shifted our 3rd best practice guideline from delirium, dementia, and depression to pressure injury management. This decision reflects the principles of the Knowledge to Action Framework and Leading Change Toolkit, using the local data to identify priorities, adapting evidence to the local context, and ensuring that implementation efforts address the greatest needs of our patients and communities we serve. By remaining responsive to frontline feedback and organizational data, we strengthen both staff engagement and the long-term sustainability of our best practice spotlight journey. With more than 300 best practice champions across both sites, far exceeding the RNAO requirement, we wanted our open house to be more than an introduction to our next best practice guideline. We used it as an opportunity to recognize and celebrate our champions' commitment to evidence-based practice while generating excitement for the next phase of our journey. By celebrating these accomplishments, we created momentum for the next best practice guideline, strengthened staff engagement, and reinforced a culture of continuous improvement. The open house also provided a unique opportunity to strengthen connections with our community, showcasing the collaborative work of local health and community partners and increase awareness of the resources available to support patients and families beyond the hospital walls. At the same time, initiatives including the pressure injury management opportunity analysis, staff education survey, wound care referrals, and clinical scholar tracking identified practice gaps. These findings allowed us to tailor the open house to address learning needs, highlight available opportunities, and promote meaningful evidence-based practice changes across both of the hospitals and community continuum of care. Shown above are highlights from both open houses, showcasing the celebrations, interactive activities, treats, community partners, and most importantly, our best practice champions. These events foster the collaboration, learning, and engagement across our organization and community. Throughout the planning process, the committee intentionally aligned the open house with our organizational 5 strategic pillars: excellent patient care, outstanding teamwork, operational excellence, community partnerships and connections, and innovation and digital enablement. This ensured the events not only celebrate achievements, but also advance organizational priorities by strengthening partnerships, promoting evidence-based practice, and connecting staff, patients, and community members with valuable resources.
So in a resource-limited rural communities, fragmented care and transitions can leave patients and families feeling isolated while limiting access to available health and community resources. As a community hospital anchor, advancing RNAO best practice guidelines depends on meaningful collaboration among the interdisciplinary staff, patients, families, and cross-sector partners. Inviting the population we serve to our open house was an essential component of this initiative. The event provided an opportunity for community members to learn about our services available within the hospital, connect with the community organizations that support care beyond discharge, gain practical knowledge to promote health at home, and through education on pressure injury prevention, including simple strategies, equipment options, skincare, nutrition, mobility, and repositioning techniques. Patients and caregivers were empowered with tips and tools to reduce the risk of pressure injuries after leaving the hospital. This collaborative approach strengthened community partnerships, increased awareness of available resources, and supported safer transitions from hospital to home. So some of the vendors that we had at our open houses included our Norfolk Family Health team, and they discussed the Aging Well program, smoking cessation, and pressure injury prevention techniques. We also had the Alzheimer's Society, which covers Brant, Haldeman, Norfolk, Hamilton, Halton communities, and they discussed the redirection techniques and repositioning. We had our nursing-led outreach team, also known as NLOT here in the hospital. They discussed the teaching on how to prevent pressure injuries from occurring when an injury, and then also as well when an injury is identified, as how they assist with the healing and to prevent it from worsening. We had our geriatric emergency medicine team, also known as our GEM team, and the goal of their program is to get people home safely, prevent ED visits, and work on safety tips and prevention of falls, refer to CCAC programs and other senior support services. We included the diabetes clinic, and they discussed the importance of maintaining healthy blood sugars and how sugars affect wound healing. We had our lovely RNAO table with our RNAO coach to discuss the BPSO program and promote champion training to our staff and community. We had our Six Nations Home and Community Care program. They discussed holistic and culturally safe care. Baxter, which is our beds, they displayed the new beds that are coming to Norfolk to display features on reducing pressure injuries. And we also had Stryker discuss the new structures coming to West Haldeman for their pressure injuries. And with that, we also teamed up with both of the foundations, with Norfolk's Foundation and West Haldeman's Foundation, and they went alongside with Baxter and Stryker to display the importance of the community support and what financial contributions go towards. So to build awareness and encourage participation in our pressure injury prevention open house, we implemented a comprehensive multi-channel communication strategy designed to reach both hospital staff and the broader community. Our local radio station, MyFM 98.9, promoted the events 1 week prior, the day before, and again live on the day of each event. The station also featured the events in its email newsletter, reaching more than 20,000 subscribers, with a primary audience of women aged 25 to 45 years old. This partnership helped us connect with key segments of our local community. Within our hospitals, promotional flyers were displayed in high traffic areas, while members of the planning committee extended our outreach by distributing flyers to local businesses and community spaces. To encourage the interdisciplinary collaboration, invitations were sent by email and phone calls were made to vendors and community partners, inviting them to participate in the open house and showcase the many ways they contribute to pressure injury prevention, treatment, and patient education across the continuum of care. We also leverage our hospital's social media platforms by sharing multiple promotional posts in the weeks leading up to the events. Participating vendors and community partners were also encouraged to share these posts through their own social media channels, further expanding our messages. And then, so funding received through the RNAO Public Visibility Grant supported the creation of the BPSO promotional banners, which were displayed at the main entrances of both hospitals in the days leading up to the open house. On the day of each event, one banner was relocated to the event entrance to welcome attendees and provide wayfinding, while a second remained at the hospital entrance to maintain visibility and direct community members to the event. This coordinated communication strategy extended awareness beyond our hospital walls, strengthened our community partnerships, and reinforced our commitment to engaging patients, families, and community stakeholders as active partners in pressure injury prevention. To further strengthen community engagement and reach individuals who may not live directly in the area but regularly access our communities and services, our team took to the streets. Members of our BPSO team participated in the Waterford Pumpkin Fest Parade, proudly wearing their best practice champion shirts, chanting our BPSO cheer and engaging directly with the community members along the parade route. To promote the upcoming open house, the team distributed flyers that provided event details and an introduction to the BPSO program. Each flyer included seed paper, creating a memorable and interactive way to share our message while tying into our ongoing theme of cultivating and growing best practices. This collaborative approach allowed us to extend our invitation beyond the walls of the hospital, increase awareness of our BPSO journey, and strengthen connections with the communities we serve. Most importantly, it created an opportunity to invite patients, families, and community members to learn more about our hospital services, community resources, and supports available to them.
Thank you, Sarah. Excellent patient care. That begins before a patient is even admitted to the hospital and continues well beyond discharge. At our open houses, members of our, Sarah's already spoken to it, but geriatric emergency medicine or GEM team and nurse-led outreach team, NLOT, connected directly with patients, families, and community members to highlight the supports available both within and beyond the hospital. The GEM program supports older adults by identifying their unique needs, facilitating safe transitions from emergency departments, and connecting with them appropriately with their community resources. Their work helps support safe discharge, reduce the risk of health decline and unnecessary hospital admissions, and promotes independence at home. NLOT demonstrated how their team supports patients and long-term care residents outside of the hospital with a particular focus on pressure injury prevention and management. They provided practical education on preventing pressure injuries at home and explained how NLOT can support care when an injury is identified, helping to promote healing, prevent deterioration, and reduce the need for hospital-based care. Having GEM and NLOT represented at the open houses allowed our community to really meet those teams, ask questions, and better understand the resources available to help people remain safe and well in the setting that is most appropriate for them. Our outstanding team. To provide guests with a visual representation of the strength of our best practice champions community, we proudly displayed over 300 champion certificates throughout our hospital hallways. Rather than displaying the certificates in a traditional row, many were intentionally arranged in a wave formation, symbolizing the social movement action framework and demonstrating how individual champions come together to create collective momentum for change. This wave went from our entrance down several hallways, going over doors, entrances, all throughout. It was quite the visual. The display not only celebrated each champion's individual contribution, but also created a powerful visual of the growing momentum and movement toward evidence-based practices across our organization. Staff were excited to search for their own certificates, celebrate their accomplishments, and take a selfie with their certificate, adding a fun and personal element to the recognition. This simple initiative helped make our champions visible, valued, and celebrated while reinforcing that every individual plays a role in creating and sustaining meaningful practice change. To further celebrate and recognize our best practice champions, during the event, we hosted a champion pinning ceremony. Champions were called forward individually by the BPSO leads to be formally recognized and receive their best practice champion pin from our RNAO coach, Julian Judge, alongside representative from our member of parliament. We also had invited our executive team and board of directors who were present to witness these dedicated individuals. While our champions displays celebrate the strength of our collective movement, the pinning ceremony provided an opportunity to recognize each champion on an individual level. It highlighted their personal commitment to evidence-based practice and acknowledged their important role that they each play in creating and sustaining meaningful change across organizations.
So one of the main attractions at our open house was an interactive pressure injury prevention escape room. It was designed to transform education into a fun, engaging, and memorable learning experience. As part of the Leading Change Toolkit, this initiative supported the adapt knowledge to the local context phase by translating evidence from the RNAO pressure injury management best practice guideline into realistic clinical scenarios reflective of our own patient population, workflows, and organizational practices. Rather than simply reviewing the guideline, participants actively applied evidence-based recommendations in situations they encounter in their daily practice. Participants completed a knowledge assessment before entering the escape room and repeated the assessment following the completion to evaluate the effectiveness of the activity. The results demonstrated a substantial improvement in knowledge, with the average pre-test score of 57% and the average post-test score of 84%. Throughout the escape room, participants worked together through challenges focused on key pressure injury prevention and management practices, including risk assessment, limiting linen layers, frequent repositioning, offloading, continence care, interdisciplinary communication, referrals, accurate documentation, and pressure injury staging. Beyond improving knowledge, and the escape room fostered teamwork, critical thinking, and collaborative problem solving. By adapting guideline recommendations to local practice, this activity increased staff confidence, generated enthusiasm, and built momentum for implementation of the pressure injury management BPG across both organizations. So our digital enablement. Our BPSO team joined forces with our hospital foundations and Baxter to provide community members with hands-on opportunities to see how our organizations are taking proactive steps to prevent pressure injuries through the use of innovative technology. Baxter brought a Centrella Smart Bed, which are new beds that are being implemented in Norfolk, to the open houses, allowing attendees to explore the technology firsthand and learn how specialized bed features can support pressure injury prevention and enhance patient safety. This collaboration also provided a valuable connection between community generosity and patient care. Community members were able to see a tangible example of how donations to our hospital's foundations are translated into equipment and technology that directly support patients and healthcare teams. The experience had benefits beyond community educations as our hospitals began transitioning these new beds into our clinical units. Open House provided staff with an additional opportunity for hands-on education and familiarization with technology before implementation. And then utilizing the social movement action framework, specifically the networks of people and resources element, it was important to engage the influential community and organizational leaders who could champion and support our BPSO journey. 3 weeks before each open house, invitations were extended to our hospital CEO, members of the board of directors, our local mayor, and our local MPP. Their presence demonstrated a shared commitment to advancing evidence-based practice and strengthening partnerships between healthcare organizations and communities we serve. We were pleased to welcome our CEO and multiple board members, the mayor of Simcoe, and our representative from our MPP's office to the open house. Their attendance reinforced the importance of collaborative leadership and provided an opportunity to showcase our organization's commitment to quality improvement, pressure injury prevention, and patient-centered care. By intentionally bringing together executive leadership, elected officials, clinical leaders, and community partners, patients, families, and the public, we strengthened our network of champions, increased awareness, and fostered relationships that will continue to support the implementation and sustainability of our best practice spotlight organization. Our staff participation, our open house would not have been possible without the dedication and enthusiasm of our staff, from completing our opportunity analysis, helping implement the best practice guidelines, providing valuable feedback, serving as organizational champions. Their commitment was the driving force behind the success of these events. We celebrated and recognized their contributions, and the best practices and champions were encouraged to wear their champion shirts to the open houses, and they were also bribed with complimentary coffee from our coffee kiosk, and the participation was exceptional. Champions were also invited to register for our pinning ceremony, and as a result, we had approximately 70 champions pinned individually, and champions who were unable to attend were not forgotten. They were presented with their champion pins during the unit tours with our RNAO coach, ensuring everyone had the opportunity to be celebrated for the commitment for evidence-based practice. The spirit of the collaboration extended beyond our staff. Our hospital foundation generously donated a door prize, while a talented community member handcrafted a beautiful wooden charcuterie board to be raffled off. These generous contributions helped create a welcoming, celebratory atmosphere and further strengthen the partnerships between our hospital and our community.
And so as an overview, both open houses were a tremendous success. Norfolk General Hospital welcomed 115 attendees, while West Haldeman General Hospital welcomed 70, bringing together staff, community members, community partners, vendors, and local representatives to learn, collaborate, and celebrate evidence-based practices. Feedback from attendees was overwhelmingly positive, with comments highlighting how proud they were to be a part of the event, the opportunity to build new connections, expand their learning, and witness the exceptional engagement between hospital staff and community partners. Beyond the event itself, the open house created meaningful opportunities for continued collaboration and knowledge exchange. The team collaborated with dietitians from Abbott for a future educational session exploring the role of nutrition in pressure injury prevention and healing, reinforcing the importance of holistic, evidence-based care. In addition, several vendors and community partners were invited to participate in our annual Skills Week, providing further opportunity for hands-on education and interdisciplinary learning. Using the knowledge to action framework, the open houses extended beyond knowledge dissemination by creating opportunities to evaluate outcomes, sustain knowledge use, and foster ongoing collaboration. The relationships established and educational opportunities identified during the events continue to support implementation of the pressure injury management best practice guideline, strengthening our partnerships and ensuring evidence-based practices remain embedded within both of our organizations and the communities we serve. Looking at our next steps, the open house really just marked the beginning, not the end, of our pressure injury management implementation. Following the events, we shifted our focus from engagement and education to putting knowledge into action. To guide our next steps, the pressure injury management opportunity analysis was distributed to staff, providing frontline teams with the opportunity to share feedback on current practices, identifying barriers, and highlighting opportunities for improvement. Our steering committee then reviewed these findings alongside our organizational pressure injury indicators to identify priority areas that would have the greatest impact on patient outcomes. In keeping with the knowledge to action framework, we use this local data to assess barriers and facilitate knowledge use and tailor our implementation strategy to meet those specific needs within the organization. A call for participation was then extended to all best practice champions, inviting those interested to join interdisciplinary pressure injury management working groups. Guided by staff feedback and organizational priorities, the group identified 3 key implementation projects. One being the streamlining of our wound care products throughout the development of a standardized product decision tree. 2, implementing a standardized pressure injury prevention bundle, the SKIN bundle, to promote consistent prevention strategies across the organization. And 3, really looking at a standardized pressure injury assessment and documentation process through the implementation of our Bates-Jensen wound assessment tool. These initiatives really represent the next phase of our BPSO journey, translating this evidence into sustainable practice change through interdisciplinary collaboration, staff engagement, and data-informed decision-making. So this really brings us to our end. I want to thank you all for your focus today and your own dedication to improving patient outcomes and staff satisfaction through the RNAO best practice guidelines. And these are the references for the knowledge action frameworks and social movement action framework. Thank you.